believe that healthcare is universal. Everyone should have access to good medical advice regardless of their locations.
So during my many years of medical practice, more often than not, when we get a certain sign or symptom, not many people actually go and immediately investigate it.
At Dr. On Call, you can get connected to our network of doctors and specialists within minutes through any mobile devices, whether you're at home, in the office, or on the go.
The platform is designed so that patients can easily find the right doctors. For the doctor, we ensure that the platform is safe, secure, and they can very simply manage their patients via remotely or even in person.
By having this teleconsult, patient can actually have a continued medical care, and this can actually save their life.
As the pioneer of telehealth in Malaysia, we always believe in closing the patient care gap through telehealth. For instance, our newly launched Doc at Home service would enable patients to book physical screening and lab diagnostic from the comfort of their homes. And this is especially crucial during this time of pandemic, where we want to keep our parents, kids, and loved ones safe.
So the platform is simple enough for doctors like us to go online, do a medical consultation in between our physical patients in the clinic.
In future, this is the way forward toward looking towards the telehealth and management, where we can overcome a lot of difficulties.
Now, as far as I am concerned, I can give uninterrupted medical advice to them. Isn't that easy for both parties?
During these difficult times, we strive to ensure that everyone stays safe without compromising their need for medical care, medication, as well as other healthcare services.
And also we can prescribe some of the initial medication online, so the patient can get treated to a certain degree before they come and see a doctor.
Our vision is to reshape and redefine healthcare. We believe in the power of technology to create better patient experience and continuity of care. We design our service for the patients to get the right service, right treatment at the right time.
During a pandemic like this, it is important not only that we should ensure the safety of patients, but healthcare professionals and doctors as well. Gone are the days where patients wait for hours in a long and busy clinic. These days, we want a seamless experience. Get an appointment booked online, see a doctor at the shortest possible time, and then get going with life.
We have never had something like this before. Upon doing the services, the patient will actually get their blood test done at their home, and the doctor is able to review their blood tests via Dr. On Call platform, or if required, they are called into the clinic. So that's pretty amazing if you ask me. You don't actually need the patient to come twice, once just to take blood and then come again. So it's very convenient for the patients, and my patients are very happy. Hello, very good evening, ladies and gentlemen. Welcome to our live Q&A session. I'm Dr. Sashini, and I am your host today. Right, so in conjunction to our Cervical Cancer Awareness Month, we are bringing to you a wonderful webinar entitled Cervical Cancer, No Women Should Die From It. So with this whole thing, our objective is to shine more light on a very grave disease that has been taking women's life globally. We're talking about approximately 500,000 women's life. That's pretty big, right? So let's get to know more about this. And with us here today, we've got a very, very special guest, a very humble yet charming young gentleman here today. He completed his undergraduate and postgraduate with a master's in obstetric and gynecology in University Malaya. He's also obtained a membership of Royal College of Obstetrician and Gynaecologists (MRCOG) London in 2007. Apart from that, he's also a certified colposcopist from British Society of Colposcopy and Cervical Pathology UK, and whereby he has got the expertise to manage abnormal pap smears and also precancerous changes of the cervix. If that's not enough, he's also a certified gynaecologist from Ministry of Health Malaysia, and he has extensive experience in managing women's cancers, including cervical, uterus, and ovarian cancer. And if the list doesn't just go on, he's also passed a professional exam and has become a certified gynae-oncologist by European Board, European Society of Gynae-Oncologists, ESGO, being the first and only Malaysian to do so, ladies and gentlemen. He's also been a senior lecturer in University Malaya, and currently he runs his own clinic, Zaharuddin KL Gynaecologist in Sunway Medical Centre. There you go, ladies and gentlemen. We have got a very well-established consultant here with us today. Without further ado, let's get the show on the road now, shall we? So, ladies and gentlemen, presenting to you Dr. Zaharuddin Rahman.
Hi, good afternoon.
Good afternoon, doctor. How are you today?
Thank you, Tashini. Okay.
Thank you so much for spending your time to be with us here today. While I was going through your accreditations and all that, I was thinking, oh my God, I might miss something. There's just so much, and I'm sure you've got such a busy schedule. But thank you once again for being with us here today.
Thank you for your kind introduction, Dr. Shashini, and then thank you for Dr. Oncol for inviting me to share what they call certain knowledge about the cervical cancer and then how we're going to prevent it. And then the most important thing is our promise as a healthcare workers: no women should die from cervical cancer.
Excellent. I love the concept already.
Okay.
Over to you, Dr. Zaharuddin.
Okay. Can I have my slide? Okay. There we go. Sorry.
Ladies and gentlemen,
today,
just to let you all know, Dr. Zaharuddin is in between his clinic schedule and he's actually given us his time, which is really amazing.
Can we start? Okay.
Yes.
I think I will just slide my slide. Okay, good. Thank you. Okay, this is what you call our topic today is cervical cancer. No women should die from it. It's something like very promising, but we as a healthcare worker, doctors, and all researchers, we tell you how can we achieve this target. Okay, first of all, we're talking about cervical cancer. Today we are talking only the cervix of the uterus. Okay, this is a reproductive organs of a woman. This is uterus. Okay, this is the cervix, also known as a pangkal rahim. This is a fallopian tube. This is ovary. Okay, even though they are connected from the vagina, cervix, uterus, fallopian tube, ovary, but they have different identity of cancer. And today, you should remember, we are concentrating on the cervical cancer here. Okay, mean that this is the what you call the cervix here. Okay, and then this is cancer which arise from the cervix of pangkal rahim. Almost 100% of this cancer associated with the virus, what we call it Human Papilloma Virus or HPV. Okay, as I mentioned before. Okay, then we go to the stage. Short stage of the cervical cancer. Stage 1 means that the cancer just confined on the cervix here. Okay, and then stage 2, they go to the vagina. Stage 3 to the side of the cervix. Stage 4 everywhere basically. So basically, stage 1 is confined to the cervix, and you got early stage, and 2, 3, 4 we call it advanced stage. Why? Because wait for me until the end of the what you call discussion, because we know the difference between the early stage and the late stage. How bad is the what you call the cervical cancer? Worldwide is number 4. Breast number 1, colon or usus besar number 2, lung or paru-paru is number 3, and cervical cancer is number 4. Almost every year, more than 500,000 women diagnosed with cervical cancer. The bad thing actually, almost quarter of them die because of cervical cancer. What to make it worse, majority of these women are from less developed country, more than 85%. And we are from the less developed country. In Malaysia is number 3. Number 1 is breast cancer. Number 2 is colon or usus besar. Lifetime risk mean that every 106 women, one woman we diagnosed with cervical cancer. In 1 year, nearly about 2,000 cases, and about 200 die because of cervical cancer in Malaysia. But what the sad thing is, only 24%, less than quarter of these women are at early stage of cervical cancer. Majority, more than 75%, advanced disease. This can be reflected because only around 22% women have regular screening every year or every 3 years in Malaysia. So the uptake of cervical cancer screening test or pap smear is very, very low. Either the women are in the big country, the big city like Kuala Lumpur, or in the remote area, the kampung area. The uptake are still very, very low. Okay. Every day, nearly 6 women diagnosed with cervical cancer, and almost 2 women die because of cervical cancer in Malaysia. You know here, as I mentioned before, only less than quarter are early stage and majority are advanced stage. When we're talking about early stage, mean that the chances to survive, mean that to live over 5 years are almost good, but more than 90%. But when the stage is advanced, so the survival rate are very low. Look at here in Malaysia data. This is old data, but it's still relevant. Look at the risk of cervical cancer below age of 25 is very, very low. But after age of 30, it's going up. So now we are going about severity of the disease in Malaysia. And the majority are old people or women around 60 to 65. So which type of women are exposed to what they call this cervical cancer? As we know, almost 100% of women cervical cancer is due to what we call high risk human papilloma virus. This is virus. We will discuss about this virus after this. How do we get it? How often we get it? And then this is the risk factor of the woman who will have persistent infection of this virus, which after that in future we develop cervical cancer. Multiple sexual partner mean that let's say a woman has multiple sexual partners, or partners which have had many partners, means that like let's say I'm a woman, I'm a partner, but I only have one partner with my partners, but my partner have another partners. By definition of medicine, multiple sexual partners mean that the last 1 year more than one partners. Smoking. Why smoking? People will ask, why smoking associated with cancer? Because smoking is up here and the cancer cervix is down there. Because smoking is associated with low immunity. So when you have low immunity, it's associated with persistent viral infection, HPV virus, which may cause abnormal cervix later. So autoimmune disease deficiency means that a low immunity. But that's not only this factor, but the biggest factor is our women never had cervical cancer screening, never had pap smear in their life. This is the biggest risk factor. So for our previous slide, we showed only 22% of women have regular pap smear. Others, they never had pap smear. Okay, what is this HPV virus? HPV virus is very common virus. It's something like flu virus. It's estimated about 8 out of 10 men or women has this virus. Because when you have sex, this virus transmitted through sex. But because of our good immunity, we get rid this virus within 16 months or 24 months without any problem on the cervix. But only minority of women has persistent infection which can be detected through the health screening. This is the virus. Look how the virus look like. Nice but dangerous. Okay, let's say you have sex, women have sex, men and women have sex, or men or woman or woman, or men and woman, or men to men sex. They have this virus. But I told you already, because our good immunity, we can clear this virus immediately, or maximum about 18 months, 24 months. Only minority of this woman has persistent infection which may cause some abnormal on the tissue. We call it CRN1, which also majority of these abnormalities will be cleared. But only minority of the group will go to the precancerous changes, which left untreated may cause cancer in future. So what we want to catch here, actually, if you have the pap smear regularly, we can detect these changes here, and then we can what they call cut the cascade. Okay, we escape this one. Okay, cervical screening. This is the two ways of cervical screening. One is the old one, we use the conventional. The second one, we call it liquid-based cytology. The old one, I think you should remember, when you put we do pap smear, we put the speculum in the vagina to see the cervix, and then we put the spatula, the wooden spatula, on the cervix and put on slide. This is an old one. We have doing it many years ago, but now majority of us have shifted to this one. Mean that we use the same what you call method. Put the speculum in the vagina to see the cervix, and then we use special brush here to get the sample from the cervix, something like this, and then we put in the solution and we send to the lab. What is different, doctor, with the brush and the what you call the wooden spatula? Okay, what's a good thing, actually, the liquid-based cytology, when you do pap smear, sometimes got blood, got discharges, everything. So they can select all the tissue, clean it, and you can see the lean cell. So interpretation is better compared to the old method, which a lot of what they call disturbances, what they call is secretion, blood. So sometimes very difficult to interpret. So I suggest you to all now, if you want to have the pap smear screening, you go to the brush one. We call it liquid-based cytology. The difference, actually, it could be where the wooden one is cheaper, and the liquid-based cytology, the brush, the water is slightly expensive, but the cost effectiveness is better than the brush and liquid. How frequent we have to do the pap smear? I like what they call the American guideline. In American guideline, they suggest if you have sex and age before 30 years old, we just do liquid-based cytology, the pap smear with the brush and the water. And then by the age of 30 and above, they suggest you to do liquid-based cytology, the pap smear, plus the HPV DNA test. Why HPV DNA test? Because we know almost 100% of the cervical cancer because of the persistent HPV infection. We believe when a lady age less than 30 years old, the incidence of HPV virus is very high which cause nothing on the cervix because it's a temporary infection. But however, if your age is 30 and above, we believe this infection was HPV infection is there for more than 2 years, which may cause some changes on the cervix. This is the Australian guideline. The Australian guideline actually, they have changed. This is the latest guideline for the Australia. They have different compared to other people because they have very good screening method, and then they believe they want to change it from the normal pap smear to the HPV DNA test. So because this is very cost effective for them, because they don't do cell anymore, but they do the HPV DNA first, age of 25 and above. And we look at the DNA test. If the HPV DNA negative, that's all. So they can do the test every 5 years. But if they found that the HPV DNA, high risk HPV DNA is positive, they look at back at the what they call cell, pap smear cell, and after that further treatment and follow up. In the Malaysian guideline, we haven't incorporated with HPV DNA yet, but it's a good practice if we follow what they call the American guideline, which we do the pap smear first below age of 30, and after age of 30 years old, we do liquid-based cytology here plus HPV DNA. DNA. In UK, they have found out what they call when doing the regular pap smear, they can reduce mortality, risk of people die from the cervical cancer by 70% reduced. So they can save about 1,300 lives per year and 3,000, almost 4,000 cases per year by doing regular pap smear. This is from UK guideline. These are all data. Okay, most of the women when they have pap smear, they are worried. They are keep calling doctors. Is my result ready? Is my result ready? Most of the clinic, because of the busy schedule, what they say is, if your result is normal, we just email you or we can post your result. But if your result is abnormal, we will call you for further follow up. We should know that 1 in 10 result shows some changes in the cell, but these changes is not cancer. Less than 1% abnormalities are cancer. What we know actually, just this is what we call cell changes, and after that, which left untreated become tissue changes, which left untreated is become cancer in future. So what we know from the pap smear result is, if abnormal, we know that somewhere around your cervix has abnormal cell, but we don't know which part of your cervix. So the next step is my expertise. We call it colposcopy. Colpo means that cervicoscopy means that the telescope. Mean that what I usually do or other doctors do, colposcopists do actually, exactly you just lie down like the pap smear. We put the speculum on the cervix and we have the telescope here. Telescope is used to enlarge the cervix and then you can see the cervix clearly. And after that, we put some solution to look at the cervix if any abnormalities on the cervix. Means that colposcopy is used to locate which part of the cervix is abnormal. When we find out that part of cervix is abnormal, we take the biopsy and send to the lab. We want to know what is the result like. We know what we call regular pap smear can reduce risk of can reduce incidence of cervical cancer. Look at the United Kingdom. They started what they call their call and recall system, mean that regular pap smear screening program at early 90s. So by 15 years, they can drop the incidence from 16 women per 100,000 women per year, it's become almost half. So by doing regular pap smear, the risk of what they call the incidence of the cervical cancer much drop here. This is what we should do in Malaysia. I skip this one. Okay. So one of the country which has a very good pap smear what you call is what they call program is Australia. Australia, they targeted what you call their by 2035 they can have a less 4 or less per 100,000 women cancer, cervical cancer incidents. By this they call it potential elimination. Not doing only the pap smear, but we go through here. Vaccination. Okay, vaccination is another arm of prevention which combined with liquid-based cytology or HPV DNA test, which reduce risk of or incident of cervical cancer. This is the 3 types of vaccine available in the market, but the right and the left one we call it a first generation what they call HPV vaccine, but this one is the second generation HPV vaccine. These two, right and left, actually covers around 70% of the virus which cause cervical cancer. But Gardasil 9, the new one, at another 20%, mean that it cover 90% or more virus which cause cervical cancer. We are very good because the Malaysian government have done cervical HPV vaccination more than 10 years. We give to the girls, 13 years old girls, as a school immunization program, national immunization program, and our uptake are very good compared to other country. We can say we are one of the best country in the world which HPV vaccination, which the uptake of this vaccine is more than 95%. Compared to developed country like America, they have only 48%. So Malaysia, we are going very good by the vaccination, but unfortunately for the pap smear or liquid-based cytology or HPV testing was still behind them. So what happened to Australia? Because they have a national screening program, pap smear for all women in 1991, and after that in 2007 they have introduced what they call HPV vaccination to the girls, for the all girls in Australia, and after that to all boys in Australia. So now, as a developed country, their incidence are very low, but 7 cases per 100,000 women. But by 2035, only 4, which is, we call it basically very, very low or potential elimination threshold. So by doing these 2 strategy, regular pap smear plus HPV DNA testing plus HPV vaccination, we can achieve what we call no woman die with cervical cancer in future. Dr. Shashini? Any question, Dr. Shashini?
Oh, I'm sorry. I think my mic is not on. No, I was just saying that it has been absolutely clear, very, very insightful, and very clear explanation. I'm pretty sure our audience have been learning quite a bit from you as well. There's a question over here, actually, Dr. Zaharuddin.
Yeah.
Would you like to take this question?
Okay, can
All right.
should I off the screening or what?
No, it's okay. I think you can answer it like this. The question is from Diana. Hi, doctor. I've taken the HPV vaccine 10 years ago. Do I need to repeat my vaccine or once is enough?
Okay, we follow the CDC guideline. CDC guideline said once you have completed the first generation, I believe that 10 years ago, the first generation of vaccination, meaning that either what they call the quadrivalent or bivalent vaccine. So that vaccine can cover more than 70% of cervical HPV which cause cancer. And plus, if you are sexually active, you start having sexually active, you can have regular pap smear. That is enough. But let's say you want to have extra protection, maybe another 20%. Yes, you can take the new what you call second generation HPV vaccine, the whole dose. You can start. You can take it now, but it's not compulsory, but it's a good practice.
Excellent. Thank you so much, Dr. Zaha. We have another question over here as well from Aryan, Aish Aryan. Salam sejahtera, Dok. Saya seorang ibu pernah membuat pap smear selepas melahirkan anak pertama dan keputusan menunjukkan normal. Perlu ke saya buat sekali lagi?
Saya suka yang ini. Kerana apa? Kerana typical in Malaysia. Bila lepas bersalin, after you give birth, they go to postnatal clinic 6 weeks. So what good thing is our clinic kesihatan or doctors in any clinic in the private or in government, they will push you. When was your last pap smear? So they push you to have pap smear postpartum. It's a very good practice because this is the only time women come to see doctors. Betul tak? During pregnancy and after pregnancy. If they didn't give birth after that, you can typically ask the woman, when was your last pap smear? Anak yang last kali doktor dah 10 tahun dulu. So I suggest you all give birth every 3 years. Sorry. Because this is how you do pap smear. Okay, let's say you have done pap smear. Katalah puan dah buat pap smear baru lepas bersalin 6 bulan lepas dan buat pap smear baru 3 bulan lepas, it's normal. Good, bagus. But betul kan nak buat lagi sekali? Ya, kalau ikut our guideline, kita buat every 3 tahun. Setiap 3 tahun, 3 tahun. Mean that tahun ini normal. Kalau ikut Malaysia punya guideline, katalah tahun ini dah first time you buat pap smear. Tahun ini betul normal. Puan buat satu lagi tahun depan normal. Dan lepas tu dua-dua ini normal, puan boleh buat pap smear every 3 years. Tetapi saya cadangkan bila puan berumur lebih daripada 30 tahun, puan buat ujian HPV DNA. Kenapa? It's very mahal sedikit tapi very cost effective. So kita tahu kalau tak ada virus ini, bermaksud most likely tak ada sel yang normal, tak normal. Mean that puan, kalau doktor saya nak buat lama sikit boleh. Puan buat HPV test DNA. Kalau HPV DNA puan test negatif, puan boleh buat test lagi 5 tahun lagi. Itu saya bercadangan. Betul, saya banyak offer kepada pesakit saya cadangkan dia orang buat 30 tahun, you just do HPV DNA, if negative, you can do it next 5 years. Nanti dia takut, betul ke tak boleh kena cancer next year? Tak kena cancer, lagi 2 tahun tak kena cancer. Based on our data, clinical data, kita tahu infection, kalau tak treated, persistent infection, after a few years, jadi sel tak normal. Sel tak normal is left untreated, tissue tak normal. Bila tissue tak normal, left untreated, tak diubati, akan jadi kanser. So daripada infection pergi ke sel tak normal, pergi kepada tissue tak normal, pergi kepada kanser, it take years by theory. So chances puan nak dapatkan kanser next 3 years sangat-sangat rendah. So saya cadangkan puan buat HPV DNA test kalau puan berumur 30 tahun ke atas.
Very well said, Dr. Zaha. I think that was very, very clear explanation. It sounds more like actually wajib kena buat kalau nak prevent. Kan?
Yeah.
Alright. So we have another question here daripada Marlima Zira. Hi Doc, adakah kanser ini sangat biasa berlaku? Apakah risiko kanser ini?
Okay. Kanser sangat biasa berlaku. Biasa pada saya lah pasal saya tengok kanser ni selalu. Okay. Apa kita cakap? Okay. Kanser ini kalau compare pada kanser buah dada ataupun breast cancer, breast cancer lagi banyak compared to cervical cancer. Breast cancer insiden dia dalam satu wanita daripada setiap 20 hingga 40 wanita, tapi kita tahu cervical cancer ni satu dalam setiap 116-120 wanita. So apa yang menariknya, bukan menarik, berita bagus mengenai cervical cancer ni, kan saya cakap tadi, daripada sel infection, HPV infection, sel tak normal, tisu tak normal kepada cancer, it takes bertahun-tahun. Jadi apa yang bagusnya adalah pap smear tak normal ni memang selalu berlaku. Jadi kena buat pap smear. Bila tak normal tu tak bermaksud kamu ada cancer, tapi mungkin ada infection atau ada tisu tak normal, bukan cancer lagi, dan kita boleh treat dan monitor tisu tu sebelum jadi kanser. Jadi kalau tanya saya, insiden untuk tisu tak normal itu memang banyak, tapi tidak perlu takut kerana itu ada ubat dia, ada treatment dia.
Okay, thank you Dr. Zaha. Actually quite clear kat sana. I think Dr. Zaha, kalau saya nak summarize apa Dr. Zaha cakap tadi, cervical cancer actually sangat preventable. Sebelum dia jadi cancer, walaupun kita ada infection, kita ada perubahan dalam sel-sel kita, it can be treated. Dia boleh diubati sebelum jadi tahap kritikal seperti cancer atau cancer stage 2, 3 dan 4. Betul ya doktor?
Betul. Kanser pangkal rahim adalah satu kanser yang kita tahu naturalistic. Maksudnya kita tahu apa yang berlaku kat dia. Punca dia. Compared to lain-lain. Yang lain kadang-kadang ada kontroversi sikit. Kerana ini. Tapi yang cervical cancer kita tahu, dan kita tahu macam mana nak ubat dia, dan kita tahu apa yang akan berlaku selepas step ini. Dan apa yang paling bagus sekali, dia ada satu screening test yang terbaik untuk kanser. Compare to kanser lain dalam satu badan kita, cervical cancer adalah satu screening test yang terbaik sekali dan kita boleh explain kat orang. Jadi ini adalah screening test yang terbaik sekali, tetapi ini Malaysia dia telah diabaikan oleh kita semua.
Okay, so itu dia daripada Dr. Zaha. Actually Doktor, I also rasa relief sikit. This is one of the preventable cancer and banyak lagi kita boleh buat sebelum jadi.
Yes.
Alright, so kita ada satu lagi soalan daripada Ziana Eldora. Makcik saya, kakak kepada mak saya, meninggal sebab kanser pangkal rahim. Adakah saya atau keluarga lain berisiko tinggi untuk dapatkan kanser cervix?
Okay, apa yang bagusnya kanser pangkal rahim kita tahu dia tidak bukan penyakit keturunan, kerana dia adalah disebabkan oleh jangkitan kuman, jangkitan virus. So kalau mak you kamu ada ke, kakak you ada ke, makcik ke, kamu tak semestinya ada. Kerana ini bukan penyakit keturunan, ini adalah daripada jangkitan virus pergi ke tak normal dan tisu tak normal dan kanser. So ini bukan penyakit keturunan.
Okay, terima kasih Dr. Zaha. Satu lagi daripada Janice Fu. What is the other cause of cervical cancer besides having sex with different partners?
Okay, basically any sex can cause what they call cervical cancer. Mean that this HPV virus is sexually transmitted disease. Transmitted. So you get it from sex, not other things. So some people will say, oh doctor, can I touch this one, can go to the side. Theoretically boleh, tapi basically this is you need sexual intercourse.
Alright, I think that's pretty clear over there. Are you okay with taking more questions, Dr. Zaha?
I think it's up to you.
Okay, maybe we'll go with one more last question, all right, before we end the session. So this is from Suhana Shahrum. After colposcopy procedure, does the woman have to do pap smear, HPV test or other round of colposcopy?
Okay, panjang cerita ni. Okay, colposcopy actually there's two things about colposcopy. It's a good question basically. Colposcopy divided into two. One is diagnostic, second is diagnostic plus therapeutic. Mean that first step, ada satu first step kita ambil tissue biopsy, that's all. Mean that kita tahu nak tengok apa jenis tissue abnormalities. But the second one is diagnostic see and treat. Mean that is based on the pap smear result, which usually showed high grade changes or invasive disease, plus the finding of the colposcopy. Meaning, let's say I do colposcopy, I look at the result show high grade disease, and I look at the cervix, I do some tests on the cervix with the colposcopy. I'm very sure, based on my experience, this is pre-cancerous changes, CIN2 or CIN3. So I will go straight to diagnostic and treatment. This is what you call see and treat. I see you, I treat you straight. Mean that I cut large, not a biopsy, not only biopsy, it's a bigger biopsy. We call it cone biopsy, or we call the loop biopsy. It's around about 2 centimeter, 1 centimeter size, and then I cut it on the cervix and send to the lab. The same time, I can diagnose tissue abnormalities. At the same time, I treat, I cut, I remove all the abnormal tissue. So by doing it, so see and treat. So the two type of colposcopy, see and treat, and then when look at the lab, and the lab will, the pathologist will do diagnosis. They put that, oh, this is CIN3, and all abnormal tissue have been removed, then it's okay. So by doing it, you don't need to do anything else. Mean that you have been treated for the pre-cancerous changes. It doesn't stop there, but you need to do pap smear again after 6 months or 1 year after that, based on what you're finding. So that one thing. Second thing, if diagnostic, if let's say diagnostic, I see at the cervix, I think, oh, this is just a viral infection. I take the biopsy and then send to the lab. The lab confirm, this is only viral infection, no pre-cancer changes, no cancer changes. So that's all. We stop what they call the treatment like that, but you may have what they call regular pap smear after 1 year based on the result. But let's say I look at the cervix, I do colposcopy, I think it's the what they call HPV virus changes plus mild changes on tissue. I take the biopsy, but somehow in the lab, the pathologist said, Zaha, this is not only HPV infection, this is pre-cancer changes. Means that I have to do and offer the patient another loop biopsy or cone biopsy to remove the abnormal tissue on the cervix. So you may need another colposcopy for treatment. And after that, based on the diagnosis, we follow up with another pap smear after 6 or 12 months later.
So I guess to summarize that was a very detailed explanation there. But I guess to summarize it, there is no hard and fast rule, but it's definitely based on the doctor's discretion, based on whatever the results of pain. Am I right, Dr. Zaha?
Yes, agree.
Okay, Dr. Zaha, I'm so sorry. I think there's one last question we must ask you. I think a lot of people would really want to know. So I'll just, can we answer this one last question? Is that all right?
Can.
Okay, this is from Tiara Mazwa. Hi, doctor. How soon a sexually active woman, in bracket newly married, should start doing pap smear? And second question is, what if a woman isn't sexually active? Should she go for a pap smear too? Thank you.
Okay, we go to the women who have never had sex. Okay. If we know theoretically it's because of a cervical cancer, is because of HPV DNA, HPV virus infection, which caused by what they call sexual intercourse. So let's say, doctor, I never had sex. So should I have pap smear? Theoretically, you don't need pap smear, but doesn't mean that you cannot have cervical cancer. But you may have cervical cancer, which other type of cancer. But cervical cancer due to HPV infection, almost none for you actually. So should you do what you call the pap smear? If you ask me, you don't need to do because you are not exposed to the HPV virus infection. Second thing, doctor, I just married last month. Should I do pap smear now? Okay, let's say we never had sex before. Okay, that was my first sex. It was last in my life 1 month ago. I come and see you. Can I have pap smear now? Okay, theoretically, we should know that even though I do pap smear now and you have the HPV infection, doesn't mean that HPV can cause tissue changes very soon. Okay, we know the idea is a persistent infection by HPV virus. Okay, so what we suggest usually after 2 years of first sexual intercourse. So why? Because we know within 18 months, 24 months, the HPV infection may be cleared by our own immunity. But after 2 years, if you have this virus, mean that the virus will be there for last more than 24 months. So if you must suggest me, you do pap smear after 2 years of first sexual intercourse.
Okay, that was excellent, Dr. Zaha. Thank you so much for your time. I think you've made a very clear presentation, and I think many of our audience today got a lot of their queries and questions answered. So, ladies and gentlemen, I think it's pretty clear over here. Although Malaysia, we've got an excellent vaccination system, without
Yes.
proper screening, we are still top 3 for women's. Cervical cancer is top 3 on cancers among women. First is breast cancer, followed by colon cancer, and third place is cervical cancer. And like Dr. Zaharuddin said, it's very easily preventable by just doing your screening, and doing your vaccination. 70% of women can be saved from this. Am I right, doctor?
Yes.
Yeah. So, ladies, I think it's high time we, start our screening processes. And thank you once again, Dr. Zaharuddin. For those of y'all who've got further questions to ask Dr. Zaharuddin, feel free to log on our Dr. On Call platform to get a consultation from him. He's an excellent consultant, as you can see for yourself. So, thank you once again, Dr. Zaha.
Thank you, Dr. Shini, and thank you, Dr. On Call, for inviting me. Thank you.
Thank you once again. Ladies and gentlemen, so you know what to do right now. If you're all afraid of pap smear, like what Dr. Zaharuddin was saying, you have to undergo a pap smear, but some of us might be afraid, oh my God, they're going to put this metal thing inside and they're going to use this spatula. Some of us get freaked out for that, right? Well, we have an alternative right now, and it's actually called an Evelyn brush. I don't know if y'all can see this. All right, it's called an Evelyn brush. It's a HPV sampling brush where you actually can do your own HPV testing at the comfort of your own home. If you want to know further details about that, you can also log on to Dr. On Call to find out more details from our panel doctors, or get consultations from Dr. Zaharuddin on how you can utilize it. And to get your HPV self-testing kit, you can actually use our code DOC HPV30 to get an RM 30 ringgit rebate on your first kit. All right, guys. Thank you so much again, ladies and gentlemen, for your time and patience. Signing off for me today, your host, Dr. Sashini. Thank you.